Hello again, friends. Jamar Doyle here, President and CEO of CHHSM, the Council for Health and Human Service Ministries of the United Church of Christ. And I am so glad to be joined today by Nichelle Simmons, who is an awesome friend of CHHSM. She's on our board, and she's also working at UCAN Chicago, which we're going to learn all about in today's ministry moment. Nichelle, thank you for joining us.
Thank you for having me. I'm glad to be here.
So, can you tell us a little bit about what UCAN Chicago is, the work that you do with youth, and just a little bit about how you also got involved in youth ministry and in youth work?
Yes. So UCAN is a nonprofit organization in Chicago, but we have offices also in the south suburb of Chicago in Riverdale that started over 155 years ago as an orphanage on the north side of Chicago, housing orphan youth. And, did that for several years. And, as the children moved towards adulthood, they really weren't prepared to matriculate into community, into society. So UCAN did an RFP to the state of Illinois to become a residential program. And from there, over the course of these 155 years, we offer a comprehensive menu of services to youth and children and families across Chicago and our collar counties. And we have a couple of statewide programs as well. I work in the teen parenting side. So I am the Associate Vice President of Program Support at UCAN, and I oversee all of the direct services within the Teen Parenting Service Network. Those services include parenting, education, and therapy support for adolescent youth in care. I also supervise the data specialist position for the network, and I serve as program monitor for the UCAN Partners in Parenting program. That program is the only specialized case management pregnant and parenting program in the state of Illinois. And so I'm really proud of the work that we do within the Teen Parenting Service Network, supporting our adolescent youth in care throughout adulthood and, through their transition out of services. I got in this work over 25 years ago. I was drawn to this work early in my career. Um, I know I wanted to work with a population that so many people found difficult, that they threw their hands up, that they just it's challenging work. It's not easy work, it's hard work, but it's hard work. And I have been amazed at the work that not only myself, but the work that um, the Teen Parenting Service Network and all of our statewide providers have done in terms of supporting our parenting youth in care. This work has stretched me. It has challenged me to think about how we work with youth when things are changing so frequently around us, how we communicate with young people. What we did 25 years ago when I first got into this field looks very different today. The world is different. I think about some of the things that our young people are faced with in terms of the violence, in terms of social media, in terms of not having adequate skills and supports and resources to be able to live, in a safe and loving environment and community. And so the work that my team does to support these young people, to build them, given their trauma history, given what brought them into the child protective services, it's just been amazing.
It is. And I love that you said it's hard work. In addition
It's
to,
hard.
yes, it's hard work, but it's hard work. And that's what I'm sure keeps you going, keeps the staff going, and has sustained, UCAN and in its various iterations for over 100 years at this point. And hearing you say that it started as an orphanage and has morphed into an organization that's meeting the needs of not just young people, but really whole families in the
Whole
greater
family.
Chicago area. Can you just go into a little bit more about the specific services? So it sounded like it started very specifically as an orphanage, but today I'm hearing it's beyond youth needs, it's
It's
adolescent
beyond
needs,
new.
parents,
Yeah.
it's the whole family. Yeah, yeah.
It is. So we have several programs. We have our residential program, we have our teen transitional living program, foster care, workforce development,
Mhm,
our counseling, our behavioral youth services, which provides counseling services and support. We have our teen parenting service network. We have two therapeutic schools, one on the west side of Chicago and one in our Beverly area of Chicago. So we are touching whole families, youth, and we have community-based programs that, not just for individuals that are involved in child welfare, but we have youth programs that are open to all youth. We have some programs that are our violence intervention program is one of the programs that I am the most in awe about that we offer within UCAN. When you think about Chicago and you think about the crime that we experience here, this is the summer, right? So any weekend, we're experiencing anywhere from 20, 25 to 30 shootings every weekend, with many of them resulting in fatalities. And so the work of those advocates to go into some of the most difficult, challenging communities in our Inglewood and our North Lawndale community where it's crime ridden, it's low income, trauma, and they are working with these families that have been impacted by crime. They are providing one on one mentorship, crisis intervention, counseling, resources, support, and they are relentless in their pursuit to touch those families. When you think about that, that's
yeah.
a scary time to go in those communities after there's been gang violence and wars that are going on. But these individuals, boots on the ground, they are there. They are responding to the needs of the community. They are making a significant impact in the community. And I'm just really amazed that that program has been able to grow. It's one of our fastest growing programs. We have
Mhm.
branched out and touched many communities outside of Inglewood and North Lawndale. And so, yeah.
No, hearing how important that work is, despite maybe the perceptions and some of the realities, right? So there's having grown up in Cleveland, and we're no stranger to sort of inner city violence in this city as well. And there is the very real violence that goes on every day, a lot of times impacting children and impacting families. And then there's the perceived violence, right? And so a lot of
Mhm.
times programs and don't want to go into those neighborhoods. They just say, like you said, they throw their hands up and say, well, this is a lost area, it's a lost cause, and you know, in our society and in a society that has so much abundance, how dare we view neighborhoods, and ultimately that is viewing people as thrown away, as in
Thrown away.
having no value, as in, this neighborhood has no value, or the people within this neighborhood have no value, unless we determine we want to reinvest in that area. It's a whole,
Mhm.
I'll get on a whole soapbox about that,
And,
but
and, and
I've
to that
just
to that
seen it.
point, Jamar, we are one agency. There are others that are committed to going into these communities, but we need to rely on other systems that we partner with. Hospitals, police
Yes.
department, other community-based aid, mental health providers, and it is a hard challenge when these organizations are attempting to go into these communities and staff are getting um, their cars broken into, they are becoming victims of violence,
Mhm.
they're just getting in and out to go to work. And so I have been amazed at the number of staff that have remained committed and passionate about doing the work, being present, getting those calls at 1, 2, 3 o'clock in the morning, responding in real time on the scene, supporting those families as they are grieving and going through just enormous, trauma, seeing their loved one lying on the pavement. Um, somewhere. So that to me is just one of the programs, because when you think about it, now I do know that they recruit individuals who lived in that community, who may have been a part of that life at a point of time. So they understand everything that the young people are going through. They know the challenges, they know the pool, that they have, and the decisions that they have to make going forward. And the fact that they are so relentless in the fact that we're not giving up, we're
Right.
not turning our back. These are our people. We have something to offer, we have a voice, and we're going to ride this thing. We want to really see North Lawndale and Inglewood and some of the other communities, truly South Shore, truly turn around and make it safe for the youth that are growing up in those families, in those homes, in those communities.
Absolutely. And, it reminds me when just shortly after graduating with my undergrad, I worked with an organization because I did my undergrad at the University of Pittsburgh, and we were working in a Pittsburgh suburb. But it, had fallen on, hard economic times. Was one of the sort of steel towns that,
Mhm.
was just really suffering economically. This is some 20 years ago. And I just remember when we went into the middle school there to, work with the kids that were there, and we're fresh out of college ourselves, right? So we're not too much older
Mhm.
than the youth that we're working with. It struck me that a middle schooler was so savvy, just kind of turned to us and said, "So how long are you guys going to be here? We've seen programs come and go." And I have to this day never forgot about that. And it just, to your point, being able to stick it out and be there and, like you said, let the youth know we're not going anywhere. We are here for you and here for the long term, not just here because a grant was written and
Mhm.
once the grant is up, we're out of here, right? Because
Right.
communities have seen that happen before, and that in many cases does more damage than it does good unless you're able to be there for it. So just hearing that long history you guys have and the
Yeah.
dedication of you and your staff to be there for the long term, it makes a difference. And you know, I heard you talk about some of the violence, and I just also wanted to, highlight that, within the past couple of weeks, the, U.S. Surgeon General has declared gun violence a public health crisis. And, what does that declaration, do you see that as doing something in terms of being able to, now that the federal government has said gun violence is a health crisis across this nation, what does that do for UCAN and the work that you do? You're already on the ground, working with youth to sort of stem the violence. How do you see that declaration helping you in your work?
So UCAN is already a leader in this space.
Hmm.
We've been doing it for quite a while, and so making that declaration, my hope is that, because again, the magnitude of what we're dealing with is by and far large and grand. And so what I'm hoping is that we can help and work with other organizations, getting them violence intervention prevention contracts, so that we can see these efforts in all the communities, because I mean it's a big it's a really big issue. And so, and partnering, and because mental health services, there are not enough providers having the resources to pay people adequately to be able to do this work, figuring out what can we do to recruit kids that are in college, get them on board to one, because they see these things and it's easy to kind of go to in another direction, like
Yes.
what I have found um, in my role within the organization, when we have experienced vacancies, I have shifted and have had my staff to shift totally away from being so focused on skills, 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 and really hire and recruit those who embody the mission, core values, and principle of the organization. Because skills can technically be taught. I can teach
Yes.
someone to do a job. I can't teach you to care. I can't
That's
teach you to
right.
have compassion for the families that are coming in and needing support and help. It takes a certain individual, it takes a certain way of communicating, And I think, you can, in our history, that's one of the things that we lead with in our conversation is the fact that we have been doing this for 155 years. You know, we have a
Yes.
long history. This is not new. We are committed. We're here, and we're going to be here.
Yes.
You lost a lot of people in 155 years, and we're still standing. And so we need people to continue to partner with us to understand that there is a lot of work that is needed and must be done in this community.
It's funny as you say that, and hopefully I have my facts right, but I'm thinking about it and thinking about the city of Chicago there. And if you're at 155, that means you've seen Sears come and go. I mean, Sears isn't completely gone yet. Maybe I shouldn't say that, but in 155 years, an organization like that, big corporate conglomerate, has gone from a
Mhm.
store to a huge, you know, chain that's everywhere back to sort of being where it's at right now. I'll just leave it that way. But we know it's
Mhm.
no longer Sears Tower, right? So,
Yeah.
but like you said, you're there, you're in the community, and have outlasted some pretty large, institutions, and it's because
Yes.
the heart that you put into it, and it's hard work. And I just wonder if there are folks who are in the Chicago area who have a heart for this work, like you said. Who really care about youth and come at it from this perspective. How do they just get involved? Would they reach out to your office? How would someone get involved? And maybe if they're listening from around the country, is there a way to donate? Just how do people, if they are touched by this message and want to support the work, how do they do that?
Yes, well, we want them and we need them. And they can visit us at ucanchicago.org. We are on all social media platforms. On the website, it's UCAN, spelled UCAN, chicago.org/donate. And we need your donations. We need your volunteerism. We need
Okay.
to recruit individuals that is going to share in this mission. They see what's going on. We're living in communities. These are the community. We have to save these communities, from violence, from just everything that we're seeing that is really tearing down communities, tearing down families, making kids feel unsafe. So we want those folks that are on fire, that want to get involved in social justice and social change and really make a significant impact in our communities. You can reach out to me directly at Nichelle.Simmons at ucanchicago.org. We'd love to see you.
Amen. Amen. And you know what? Last question before we go. Just given that this work is so challenging, what brings you joy?
Oh, what brings me joy is when you've had an opportunity to see youth that you've worked with and they age out of our program at 21. They are 30 and 40. And some of these kids I worked with 25, 27 years ago, and they,
Mm,
one, remember your name. Do you know how many workers they may have had over the course of their time in care? How many social service agencies that they've been affiliated? They remember your name. That's important. They remember what you poured into them. That's
mm,
important. So it's the small things. It's knowing that, you're not going to always get the outcomes or the results that you want, but to know that you are making a difference and that, to hear them say, I didn't listen, Miss Davis. That was my name at the time. I didn't listen, Miss Davis, when you were trying to teach me this or you were educating me about that. But I did go back to school. I did graduate. I'm in college, or I've achieved my bachelor's degree. And hearing those stories and know that you played a part in some way in that person's growth and that development, that brings me joy. It brings me joy when I look at the number of people that we've been able to work with over these years, um, tackle their trauma issues, um, graduate school, be able to build a safe home and family for their children and have stable housing and be able to transition out and know that they're doing well. What brings me joy is the folks that I get to work with that I'm in the fight with every day. I learn from them. They are just as hot and passionate about the work as I am, and so we motivate each other, and that ignites me and it excites me.
Hey man, you've got me excited. I'm like ready to. I need to get to Chicago and sign on up. It's a short flight from Cleveland, so.
It is. It is.
I thank you so much. I can see the passion, the energy, and just the compassion that you bring to this work, and that it truly is hard work for you, and I know it's hard work for the rest of the team there at UCAN. Just a fabulous Chisholm agency. We're so happy to have you be part of our network, and I'm so happy that you were able to share a little bit about your story as well as a little bit about UCAN and what you all do today with us for Ministry Moments. So thank you so much, Nichelle. I appreciate this time.
Thank you so much. Thank you for having me.
Everyone, I hope you've enjoyed this ministry moment with Nichelle Simmons from UCAN Chicago. As you heard, if you have been pricked or touched by anything that Nichelle has said, please visit their website, UCAN Chicago, ucanchicago.org. If you can't get it there, you'll see a QR code at the end of this video. Scan the QR code, it'll take you to the Chisholm website where you can find UCAN and all of the other Chisholm agencies. Just use our Find a Provider and you'll be able to get linked to them. Nichelle, thank you so much for your time today. This has truly been a blessing to hear about the work that you're doing for the youth in Chicago, particularly at this moment when it is so important for our youth. So thanks to you and thanks to the whole staff and team at UCAN. We appreciate what you do. And friends out there, wherever you are, we appreciate what you do too. Thank you for joining us for this ministry moment. Join us next month and every month. You can look for ministry moments every month in our Diacony newsletter. If you're not already signed up, again, please just scan the QR code. You'll find a link on our webpage where you can sign up for our monthly newsletter, Diacony. That way you don't miss a moment of ministry moments. Again, Nichelle, thank you so much. All
Thank
of you,
you.
be blessed. Take care.
Bye bye.
Bye-bye.